A strategic plan which will span from 2014 to 2020 has been mapped out by the Health Ministry to strengthen the national rehabilitation services. The plan, which is receiving the support of the Pan American Health Organization PAHO, was plotted under the theme towards improved health partnerships and inclusiveness for all persons with disabilities.
The goal of National Rehabilitation Services Strategy 2014-2020 is to support the realization of Health Vision 2020 for persons with disabilities in Guyana through advancing their well-being, functionality, and quality of life, reducing health inequities, and delivering people-centered, quality, integrated, and comprehensive disability and rehabilitation services.
Debita Haripasod, Director of Rehabilitation Services Acting, Ministry of Health. Health Minister Dr. Barry Ramsaran challenged the crafters of the plan to ensure that it becomes a living one.
I'm suggesting that we need now to say the work has just only begun. And like what we're trying to do with the mental health strategy, get a national conversation going, like the issue of special transportation for these people. It has a cost. So can we afford it? How do we do that?
The minister would go on to explain that while in the national budget, the amount of money allocated for the respective population is small, it represents an effort to assist.
We are told that people living with disabilities in Guyana might be as much as 50,000 at any one time, 50,000 Guyanese. And some studies say it might even be a little bit higher because the 50,000 is based on the census. And the census might have missed persons who are institutionalized or persons who are homeless. So it's anywhere about 50 or slightly above 1,000 Guyanese living with disabilities. The people living with disabilities enjoy not only medical or health services, but we approach it as a multi-sectorial problem, as a social problem.
PAHO WHO representative to Guyana, Dr. William Adukro, explains that the prevalence of disability is growing, with an already estimated 1 billion people worldwide living with one form of disability or another.
Once we have a disability, we have a human right and responsibility to make sure that there are services for persons with disability. Across the world, more often than their non-disabled peers, people with disabilities do not normally receive the health care they need or have poorer health outcomes.
It was also pointed out that the number of health professionals to assist with rehabilitation services across the country is way below the required average. Handel Duncan, HGP Nightly News.